How does TB get diagnosed? What are the most reliable tests? Where are these tests available?
Okay, sure. So the most common tests include a chest X-ray or CT scan. The second one is sputum test. The purpose of sputum test is to check the phalgum, that is called as cuff, and which has the presence of TB bacteria, to understand which type of TB you have. And also there is a bronchoscopy test done if the phalgum is not really doesn't really come out, so bronchoscopy is done in that case. And so the bronchoscopy, however, is costly, but it is encouraged for the patients to take it, so that you know because see, as I told you, which type of TB you have, that is really important to know. Then so if the patient is symptomatic of extrapulmonary TB, several tests can be used to confirm suspected extrapulmonary TB, and it may include a CT scan, MRI scan, or ultrasound, so USG. So USG scan as well. To understand that the TB is affected to which body parts. So there is a myth that TB only affects to the lungs, but no, TB can affect on other body parts too. So once the site of infection is known, other procedures like FNAC, FINAC, EBUS-CT, or USG. So also biopsy is done. Sometimes there are nodules in your near your neckline or something like that. So to understand which type of nodules they are, the biopsy is also done at times. There is lumbar puncture, which is done. The surgical debridement might require to collect samples of the further testing to understand what is the intensity or what is the depth of the disease that has gotten into your body. So these tests are available in local hospital, in the public, and also in the private sector. So the patient, wherever that he is comfortable, he or she is comfortable, they can avail it going there.
What tests are not for diagnosing TB, or what tests do not conclusively tell us we have or don't have TB?
Okay. So I think blood tests are banned and should not be used. So people think that by blood tests, probably you can understand whether you have TB or no, but no, blood tests are completely banned. And other kinds of misleading tests should also not be used. So all the tests which I mentioned above to you, like X-ray, CT scan, MRI, all or sputum test, all these tests are necessary. The blood test especially is banned to understand whether you have TB or not.
TB and COVID symptoms can be similar. So, when patients are not diagnosed with COVID, should they be getting a TB test? Where can they go to be tested for TB?
So I think every patient ideally should get both the tests done, because COVID is also related to lungs, and TB is also in most cases is related to lungs. So that is why I think both tests are necessary to be taken, because it's important to rule out whether you have COVID or whether you have TB, because sometimes the symptoms are quite similar. And TB often progresses unnoticed, and doctors don't order TB tests early. Hence it is important to remember that TB may be present, but it not be really noticed. Because in my case also, I would tell that there were after 2 or 3 weeks of coughing, it is said that usually you should do the tests, because I think initially nobody is going to tell you whether uh, you should do the TB tests or no. But I think after 2 to 3 weeks, TB tests are necessary to be done, and yes, COVID tests as well, to rule it out.
When does one get a TB test? Because doctors often don't recommend it early.
So I think one should get TB tests only when you see the symptoms. Okay. Uh, so I think some of the other symptoms will definitely come out. You may have fever, you may be coughing, you may lose your weight, you may, you think that your appetite is going. So, if you're seeing such symptoms, you can take a test. You can ask your doctor to suggest it to you. If you are sure about the symptoms, you insist and get one. Like sometimes, doctor will say, I think you don't need it, but sometimes you can just insist for your satisfaction, mental satisfaction. You should, if you really feel that these symptoms could be TB, then just get a test done. I mean, there is no harm in getting a test done and ruling it out, instead of just hanging it and delaying the process. If you really have it, nahi hai to it's better only. But I think if you really feel you have, you can insist the doctor and get it done. And yeah, so again, I think you should not delay if you really think it is necessary.
What is the most reliable test for DRTB? How do we get the doctors to order one?
Okay, so the drug resistant TB. So the most reliable test over here is culture test, and that's the gold standard. And we need to get that done to for the drug resistant TB, to understand which drugs are going to be suitable for your drug resistant TB. So since I had drug resistant TB, I could relate to these culture tests very much, because there were few medicines which were ruled out, which were like completely banned for me, and there were few medicines which were suitable for me. So it takes time. It takes around 3 to 4 weeks, but I think it is very much necessary to do. Doctors should order one early to rule out the drug resistance, and if we don't, we are maybe putting the patients through unnecessary treatment and delays if we don't do the culture test. So I think culture test, taking it is very, very essential.
TB diagnosis can be traumatic. Everyone thinks I can't get TB. Others think TB is not common. What should one say when TB is diagnosed?
Okay, so I think when TB is diagnosed, one should understand one very important thing, that TB is curable. It is completely curable, and unless and until you are not taking medicines on time. So it is curable first. TB doesn't stay with you forever. Okay, and then so people have a myth that if I have TB, this is going to stay with me for lifelong. No, TB doesn't stay with you forever, for sure. Anyone can get TB. Anyone. There is no such thing that only specific amount of people, or only these people who are thin, or who are only the people who are just thin who are going to get TB because they are very thin. Their immunity might be no. That is not for sure. Anyone can get it. You are not to blame in any way. So it is not your fault that you are getting TB. You don't know from where it is coming, right? Especially in India, you just can't understand, because the kind of population we have and the kind of TB patients we have in India, we can't know from where we are getting it. So you need to find out what kind of TB you have firstly. I think it is very important, because there are various types of TB. Then you need to ensure you get the right diagnosis and right treatment on time. So if all these things are kept in mind, I think one should be very rest assured that TB is not a very hazardous disease unless and until you don't take it seriously.
What is the role of follow-up tests? Because a lot of patients don't know when to get follow-up tests.
So I think follow-up tests are very important. Again, with my example, I can tell you follow-up tests. I was doing every test after 3 months, even after getting diagnosed. In my 2 year journey, I was taking follow-up tests in every 3 months, because the status is really important to be known. So they tell you if the treatment is effective by detecting the level of bacteria in your sputum and at the site of the infection. So follow-up tests for other parameters are also important, because we know if there are any other challenges emerging due to the treatment. Okay, that is why I think follow-up tests are very important. Again, I'll give you a small example. In my case, during a follow-up test, I came to understand that I was having a side effect because of one of the medicines, so I had to stop those medicines. If I wouldn't have done the follow-up test, I wouldn't have understand that I am having a side effect and I should really stop that medicine. So with that example, I can tell you that follow-up tests are really very important for all these necessary reasons. Yeah.
What test is needed to tell you that you are TB free? And if you want to check for recurrence of TB, what test should you be getting?
I think a sputum test will be the best to understand whether you're having TB or not. A sputum test tell you whether you are TB free at the end of the treatment. Basically, asking your doctor is, I think, best advice. The doctors will be the best person to tell you whether you should take it or no. But then, and it is also costing you free in case you are going to the government hospitals. So I think the sputum test is the most important test if you really want to understand about the status of the bacteria in your if it is there or not.